Thank you for staying with Sunrise and with me. Here's the question. How well are we doing mentally? In other words, how well are we doing in terms of mental health in Ghana? Well, experts tell us that many of us might be in need of serious professional help. And if you look at the World Health Organization, in its situational analysis of Ghana's treatment situation, they say that there is a gap of 98% of the total population. Now, I wonder what that means. And I also wonder how something like this could hit the headlines, where mental patients with deadly weapons attack doctors and nurses. To help me and you get a better grasp of the situation and look at the insides and all the sides to this story, I've got Dr. Akwasi Osei in the studio with me. Now, he is Ghana's top psychiatrist. He is the chief psychiatrist at our health service. He's also the medical director of the Accra Psychiatric Hospital, and it was his interview with the Daily Express that I was referring to in my introduction to the theme. Good morning and welcome, Doc.
Good morning, Don. Thank you very much.
How are you feeling?
I'm great. And you too?
It's very unnerving, to speak to a psychiatrist, because every single time in my life that I've happened to be in one of the mental hospitals, the first question has always been, who's the patient?
You're right, but I can assure you that you are now very well. So rest assured.
Thank you very much, Doc. So is this story a fact? I mean, these weapons, knives, and I don't even know what this is, and ropes. Mental patients have these and actually attack doctors such as yourself and nurses with them?
Yeah, it's a reality, and it could be scary. Thank God it does not happen often. But once in a while, when it does happen, it could be dangerous. Now, those implements you saw are actually those weapons I have in my desk, and they were actually taken from patients. So I've kept them in my desk for evidence, as exhibits. But it does really happen. But these were collected from patients as they were being admitted to the wards. So that's the routine. Before we admit any patient, we search him and make sure that he does not carry any dangerous weapon. So any slight omission on your part, if you overlook that aspect and you admit the patient, then such a patient could be carrying this. As part of their illnesses, at least for some of them, they are paranoid and they have the belief that somebody may be attacking them. Not all patients, but for some who have that kind of condition, that somebody may be attacking them. So they arm themselves against such an attack. And if you happen to be the person he thinks you are attacking him, then he may use it on you. So the staff, the nurse, the doctor may represent somebody that the patient thinks is the attacker and may use it in defense, then to attack you. Or else he may simply be irritated, and anybody there, you become the object of the target of his anger, his irritation. So it does really happen. I myself have actually been attacked before. There was a time a patient was really going to attack the mother. The patient said, "You, my mother, every time you send me to the hospital, you don't let me have my peace. Why?" And he pulled out, in fact, he took my own pen, which had very sharp nib, and he was using that to stab the mother. And I realized that if I don't jump in immediately, he could actually kill the mother. So I jumped in to defend the mother, and he turned it on me. And the nurse had to come to my rescue. Before I could release myself, at least my shirt was torn. My predecessor was actually also once attacked by a giant, a patient, but he is, more gigantic, so to speak. So he was able to overpower him. So it does happen once in a while. There have been instances where patients, staff, somebody was injured in the eye and got blinded. Such instances, but thank God it does not happen often, and we are also alert. But once in a while, it does happen.
What sort of provisions do we have to forestall or prevent, manage, or even compensate staff who are exposed to such hazards, to such risk and danger?
Incidentally, very little. The training that you are given at school is supposed to arm you. That training is supposed to get you to appreciate that you are working with people who could be dangerous, not always dangerous, but could be dangerous, and so you are supposed to be alert. So even as I'm writing, for instance, at the tip back of my eye, and I know that I could be in a dangerous situation, so I'm always careful. Everybody's always careful. But you lose that slightly, then it can happen. Elsewhere, what happens is that, in fact, the antidote actually is that for instance, one nurse is supposed to work with, attempt to not more than 5 patients, 4 or 5 patients. So that if you have one nurse to 4 or 5, if you have 20 patients, there are 20 patients, it means that 5 nurses, so to speak, then you could really you'll be able to forestall any such eventuality. But if you are one person attending to 2 people attending to about 160, that means 1 to 80 sometimes, then really you are at risk. That is it. Elsewhere too, they could have special security for such patients. We don't have any such special security. Our hospitals, the 3 hospitals, we have devised our own means to get some security to support. But again, because you don't have money to employ and engage a lot of them, they are very few, and they are really not attached to the wards per se, but at the entrances. So again, that exposes us to a whole lot of risk. Again, elsewhere, they have incentive packages, risk allowance. So though you don't pray that any such eventuality happens, if it does, then at least it mitigates your discomfort. We don't have any such risk. So all these are difficulties that we are exposed to. And these are reasons why young men and women don't want to come into mental health, among others.
How dire is the situation outside the walls of psychiatric hospitals? I know of 3. There's the Akwasi Psychiatric Hospital, there's the one in Pantang, and there's the facility at Ankafu. And experts tell us that a huge percentage of our population actually is in need of mental health services from professionals such as yourself. The World Health Organization says that there's a treatment gap of 98% of the total population. Help me put this into layman's terms, get a real picture of what is happening in terms of mental health outside the hospitals.
Mental health care in Ghana generally is not good enough, I must say. If you ask me to put it on a scale of 1 to 10, 10 being best, 1 being poor, probably 2 to 3. Over 10.
We'll score a 2 or 3
2 over 3. That certainly
out
is
of
bad.
10.
Out of 10. And that is no exaggeration. That is bad. Even though I must say that even this 2 over 3 is amongst the best in the sub-region. That tells us that we are all not taking our mental health care situation seriously enough. And it has various and serious repercussions. A lot of events that happen in the society that we call social vices are really mental health issues. Somebody attempts suicide or commits suicide, it's a mental health issue. We don't recognize that, so we say let's take the person to the jail if he does not succeed in his suicidal bit. As a society, we don't recognize mental health issues. These days we are hearing a whole lot of things. Somebody goes to slaughter, literally, a boy. Somebody kills his wife, a grandmother, burns literally the buttocks of the grandchild. These are mental health issues. Elsewhere, if anybody commits heinous crime, the first thing is, why will such a person in his normal state of mind commit such a crime? Therefore, let's go and check him. And they are right. We will say, this is a criminal offense, let's take him to the jail. And so what happens is that literally a lot of people in jail actually have mental health problems who really need to be attended to. So you take him to jail, he comes back, the mental health issue is still there. So you commit the crime.
Well, I don't know how many prisoners we have in incarceration right now. In other words, what the population of our entire penitentiary system is. But I read from this article that you've got about 1,200 patients at the Akwasi Psychiatric Hospital, but that it is estimated that there are 725,000 Ghanaians suffering from severe mental disorders. That means that the larger part of mental patients with severe disorders are not being treated in hospitals and perhaps have never ever spoken to a psychiatrist.
Precisely so. And the 750,000 might even be an underestimation. The reality is that conservative estimate is that 10% of Ghanaians have a mental health problem. Conservative. Worldwide, we know about 20 to 30% of various societies have mental health problems. If I say mental health problems, it doesn't necessarily mean they are mad. It's a degree, a whole range of mental health problems, from the very mild to the very severe. And so the 750,000 actually is talking about a very severe form who might require admission. One, people don't recognize what mental health problem is, and therefore they may not send a person to a mental health professional. Two, even if they recognize that there's a mental health problem, the reason they associate, they adduce to the mental health is spiritual. And therefore, if it's spiritual, then he does not belong to the hospital. So let's take him to the prayer camp, to the traditional healer, what knows. Three, if he goes to the traditional healer, he might be put incarcerated, put in chains and shackles and what knows. And the prayer, the proprietor will also reinforce the belief that this is spiritual, a whole lot of things. And four, eventually, if he decides to come to the mental health facility, how many are there? Few. So that leaves that big treatment gap, 98%. So what it means is that for every 100 people in Ghana who require mental health care, only 2 are really getting it.
We are caught in the vicious circle of the social stigma, the superstition and the inadequate science of mental health professionals such as yourself, the psychiatrist, what do you think the way out could possibly be?
Thank God the way out is very simple. Very simple. We've looked at all the issues over the years and put them all on a paper. So we've identified the problems, identified the solutions, and put in a document called the Mental Health Act. All that it requires of us is implement the act. And I keep saying that not any other single problem in the country has a solution that mental health already has. No other aspect of our economy, no other area, and I can be challenged.
What do you mean by that?
What I mean is that we have sat down, we've documented the problems and put them in a simple chart, a simple book, simple document, the Mental Health Act. If you implement it, trust me, if we implement it and implement to the letter, all the numerous challenges, numerous problems of mental health will be solved. If there is any other aspect of our economy, of our life that has such a document, produce it.
Is it a question of investing more money, more resources into the sector, or is it simply a case of a different approach, a different management method to what we already have?
Altogether, we need a paradigm shift. The current paradigm, the current approach to treating mentally ill is put him at the psychiatric hospital. And indeed, this approach is an improvement over what it used to be. In the past, if you look at the mental health legislation in 1888, when the first legislation was passed. At that point, mentally people were left at the mercy of the elements, the children, everybody. And so the ordinance was passed to say, arrest them as special prisoners and put them in a special prison. That was in 1888. Then in 1972, that was revised to say, no, put them in a psychiatric hospital and give them the best of care. That was revolutionary. It did not recognize the mental ill outside the psychiatric hospitals. We are saying that we need to move from that. We need to move from that paradigm and say that mental ill patients can be treated in their communities as close to their homes as possible. That's what we call least restrictive environment. So treat them in their communities as close to their homes, and that means spread mental health services all over the country. Not as huge as we have facilities as huge as we have across Psychiatric Hospital or Anchor for Pantan. Small facilities. Every hospital, every regional hospital, district hospital, every hospital should be able to attend to the mentally ill, and every health person should be able to attend to the mentally ill at least first aid level. If it requires more specialized care, then it goes to the specialist. If you implement such a paradigm, you'll spread mental health services all over the country. That is one aspect. The other is that, yes, there is a lot of ignorance about mental illness. So give a lot of public education so that people will understand. If they understand, they will be able to provide for themselves self-help, self-care. If it goes on further, then that is where the professionals will come in. We are also saying that even the traditional healers and the prayer camps, by virtue of our, we are religious as a society, no problem about that. But sometimes we take our religiosity to superstitious dimensions, and that often is the situation. So we will say that is caused by witchcraft, juju, whatever. So let's go to the prayer camp. So we are saying people will go there anyway. If they will go there, then let's train the traditional healer. Let's train the prayer camp, the proprietor, the healer, the spiritualist, so that they will recognize what mental illness is, what they can handle, what they cannot handle. So we collaborate with them, and then they can even be source of referral. If you do that, since they are actually attending to about 70% of our patients, then they will be the first port of call. So this law, the Mental Health Act, is that you recognize them, train them, regulate and monitor them. And if they go beyond their bounds, then they will be sanctioned. And then, of course, almighty funding. The law makes provision for establishing mental health fund. So if you have this fund established, then the problem of you don't have money, you go and cry and get a little something will be a thing of the past. So all these are packaged in the Mental Health Act. What is left is to implement it. What do you mean by implementing? The first step towards implementing is establish a mental health board. That will be the governing body to oversee the implementation. That board is already 8 months overdue. The act was enacted, it was signed by Parliament, it was passed by Parliament on the 2nd of March 2012. assented to by the President on 31st of May 2012, and 6 months thereafter it should have been implemented. 6 months would have come to November ending last year. We are already getting to the end or the middle of March. So we have already started violating our own law, meaning we are not giving enough seriousness to our mental health care. That is the bottom line.
Now,
let's implement it, and that is all.
What could the reasons for this be? Is it because the extreme cases of mental disorders, the ones that turn people violent, like the ones that we started our conversation on, are relatively rare? They are in the minority. Most of the 750 or so thousand Ghanaians suffering from mental health problems without access to mental health facilities might not even be violent. They probably won't need a psychiatrist. They might need a psychologist.
That's the very point you're making. Not everybody who has a mental health problem requires a psychiatrist. There are different levels of mental health professionals. As you said, the counselor, even the lay counselor, is taking part of mental health service delivery. Yes. So the lay counselor, the professional counselor, the psychologist, the psychiatric nurse, and then the psychiatrist, a whole lot of them. So a good number of them will require just preventive. If they understand, that is where we talk about the promotional care. So we give them the information, they'll be able to attend to themselves. If you know that I'm having I feel a little tense up, I feel a little restless, I'm having some burning sensation. What could be happening? Maybe I'm overstressing myself. So let me relax. That is mental health care. I try to relax, it's not, so that is so self-care. I try to relax, it's not helping. Let me go and see my uncle and get advice. Let me go and see my pastor and get advice. Let me go and see my deacon. That is mental health care, informal. It does not work. Then let me go further and go to my community psychiatric nurse or to my general practitioner and let me get some advice. That is it. You are not going to the psychiatrist, but you are getting mental health care. All that does not work. Or I'm becoming aggressive. My brother realizes it. Let him take me to the for admission at the general hospital. That is mental health care. You're not going to psychiatrist yet. All that does not work, and then let's take him to the psychologist or the psychiatrist. There you are. So you realize that in that case, very few people will require psychiatrists. Before you get to him, you would have taken care of a whole lot of issues. That is the understanding that we need to get, and that's the paradigm shift. That is what is in the Mental Health Act that we need to implement.
We train lots of psychologists, though, every year. Do they find jobs in the mental health sector?
Until only very recently, the ministry did not have an established post for clinical psychologists. In other words, the ministry did not recognize the value of clinical psychologists.
But we do now.
Now we've recognized them, and we are saying that we can employ about 12 a year. We have not started employing them yet. So in the public health sector, we have just about 3 or 4, maximum 5 clinical psychologists who are fundamentally employed not as clinical psychologists, but as other things, like the person was a nurse and became a clinical psychologist, so he's still paid as a nurse. Or the person was a medical doctor and became a clinical psychologist, so still paid as a medical doctor. But now we have established the post, thank God. All we need to do is to employ more. And they will not be at the psychiatric hospital alone. We will need clinical psychologists in all health facilities. Because as I said, many cases don't need to go to the psychiatrist. They can be attended to at the general health care level or even in their homes by clinical psychologists and other mental health workers.
You mentioned at the beginning of our discussion that on a relative scale, Ghana, we are doing pretty well compared to other African countries. Now, does this make you feel good or not good enough?
Not good enough. If you, the late Minister for Health, Major Kwasi, used to say, don't compare yourself with somebody down there, else complacency comes in. Compare yourself with somebody higher than you. Then you aspire to go further. Truly, there are many other countries in the West African sub-region that don't have a single psychiatrist. So that does not give us any consolation at all. We need to aspire to what is good enough, and not just because we are better than somebody else. So it does not give any comfort at all. Our situation is bad, and it can be improved. That's the bottom line. It can be improved. So if you have the opportunity to get better, why be happy with good?
Maybe because it's very expensive to deliver good mental health services. In Ghana, mental health care is free, but that's for the patients. Is it very expensive to deliver quality mental health services to every single Ghanaian?
Yes and no. The bottom line is, what is the value you place on your health? And there is no health without mental health. So if we place value on our health, and we recognize that by definition, total or complete health includes mental health, then you need to place a lot of premium on it, no matter how much it will cost. And truly, if you really invest in mental health care, the initial capital will be expensive, but eventually it becomes very free, very cheap. Because as I said, if I get you to understand that this stress, this burning sensation you are having is as a result of stress, and therefore see how you relax, it's free. You don't need to go to anybody to pay anything. But as at now, though the policy says mental health care is free, it's actually even not free to the mentally ill, because there are unseen expenditures you incur. If it's free, it means that I must have it at my doorstep. If you're at Tatale, Zabzugu, we don't have a psychiatric hospital there, and you have to come to Accra to get your free mental health care, your transportation cost, government will not pay for you. You may need to charter a vehicle to about 400 Ghana cedis. So if you come and you get your drug free, what about the 400 Ghana cedis? So really it's not free. Even you come to the psychiatric hospital, you are supposed to get it free, meaning that even time, everything. Who wants to spend the whole day at the hospital? So you come there because the mental health workers are few. You have to sit there for a long time before you get your care. Yes, at the end of the day, you get your treatment free, inverted commas. What about the time you spent? Now you are coming not alone. You are coming with, because you are aggressive, others have to bring you. 3-4 people bring you. They did not go to work. So productivity is low. So it's not free. Again, the medicine that is written for you, you may not always get it there. You will have to go and you may need to go and buy it from town. You won't get reimbursement because it's not covered by national insurance. So in theory it's free, in principle it's not free. All these are issues. So at the end of the day, what we are really doing is expensive. If you put all these measures in place, it will then be eventually cheap.
What measures can we put in place to address the stigma, the social stigma that's associated with mental illness? Because I'm sure if you said, well, everyone in Ghana who is in the public sector should go for periodic psychological evaluation and referral to a psychiatrist if the need be, and I ask you, how many people do you think would actually get referrals? I'm sure you'll give me a very stunning figure. But that's because we simply don't have this now. And perhaps one of the reasons we don't have this is because people are so afraid of mental illness. There's this stigma that goes with it. What can we do to reduce the stigma or totally eliminate it?
That is also part of the package in the Mental Health Act. Very often the stigma is from ignorance, one from fear, and the fear is from ignorance. Oh, the mentally person is very aggressive, so don't go near him. Or his mental illness can be even transmitted to you. Like somebody with epilepsy is not mental illness anyway. Somebody with epilepsy, if the saliva touches you, you'll get it.
This is not true.
It's not true. But because of that, so you are afraid, and so you don't want to go near him. And because you are afraid, then you stigmatize him, so that it gives you a reason not to go near him. But it's not true. If you get to know that that is not true, then the fear will be dispelled, and then you'll be able to embrace him. So the mentally person, we say he's aggressive. But the reality is that the average person on the street is more aggressive, more dangerous, more violent than the average known mentally ill person.
Thank you very much. Some stunning revelations from Dr. Akwasi Osei, Chief Psychiatrist of the Ghana Health Service and Medical Director of the Accra Psychiatric Hospital. I hope you've enjoyed the conversation. I hope you've learned a few things. For example, mental illness is not infectious, not contagious. Epilepsy is not mental illness. All we need to do is just think and act accordingly. Thank you very much for sharing your time and your knowledge with me and with my viewers.